Hello everyone, this video will be a temporomandibular joint mnemonics. It will help you understand a couple of important points about temporomandibular joint. This video for those who's taking MRCS OSCE exam, but it could be helpful for anyone who want to learn about temporomandibular joints. Firstly, what the type of the temporomandibular joint is biarthrodial hinge joint, which is a synovial joint. How you can remember it? You can remember it by remembering the word bite. P-I-T-E. You use your jaw to bite food. In the bite, the first two letters are P-I, pi, biarthrodial hinge joint. What are the articulating surfaces of temporomandibular joint? There are three: tubercle of the squamous part of the temporal bone, head of the mandible, and fossa of the mandible. So we have tubercle, head, and fossa. How you can remember it? You can remember it by remembering the mnemonic taste healthy food. You bite and taste healthy food. The T in the taste for tubercle of the squamous part of the temporal bone. The H in healthy is for head of the mandible. And the F in food can remind you of fossa of the mandible. And it does make sense because you bite and taste healthy food. He bites and tastes healthy food. By remembering he bites and tastes healthy food, you can remember the 2 points. What the type of the temporomandibular joint is biarthrodial in the word bite, and you can remember the articulating surfaces by remembering tastes healthy food. Okay, jaw muscles and their action. Tom, you can remember them by remembering Tom mouse masticate large grapes. Tom mouse masticate large grapes. Each word corresponds to the first letter of the muscle and its action. The word Tom is corresponding to temporalis. What's the action of temporalis? The action of temporalis is temporarily close your mouth. As you can see, there is a highlight of the word temporal, which equal temporally close your mouth. So you can remember it this way. So if you want to remember the muscles, you remember Tom mouth masticate large grapes. And if you want to remember the action of each muscle, the action of each muscle is inside the muscle. Temporalis, temporally close your mouth. The M in the mouth is masita, which is massive power for jaw closure during chewing. So if you want to remember how the masita work, from the word mass in the muscle masita, you can remember its massive power for jaw closure during chewing. And the next M in our mnemonic, Tom mouth masticate, the next M is medial trigoid. And you can remember the action of medial trigoid by remembering the word medic from the, and as is highlighted here, we highlighted medi in the word medial trigoid and medic. Medic for pulling your jaw upward to close gently. So it does help in pulling your jaw upward to close gently. Letter L in the word large is correspondent to lateral trigoid. What does lateral trigoid do? It's from the word lateral trigoid. It's lateral move for jaw opening and side to side movement. So when you move your jaw side to side, you move it laterally, right? So it's a lateral trigoid. And the last word in our mnemonic is grape, which reminds you of the muscle gynohyoid. You can remember the function of gynohyoid by remembering gyne, which is like gentle, gyne, gentle jaw closing, speaking, and swallowing. So when you do the gentle things like speaking and swallowing, speak and swallow gently, this is a gynohyoid. Summary: remember Tom mouse masticate large grapes, which will give you the muscles. And then after you figure out the muscles, each muscle, from the name of the muscle, you can figure out the function. Okay, our last mnemonic for today: muscles that open the mouth. They are digastric, lateral trigoid, gynohyoid, and mylohyoid. How you can remember this? You can remember it easily by remembering dynamic leader, get mouth open. Dynamic leaders get mouth open. The D in the dynamic for digastric, the L in the leaders for lateral trigoid, the get is for genohyoid, and the M for mylohyoid. And I can guarantee now, if I ask you what the function of lateral trigoid, you're gonna answer it. What the function of genohyoid, you're gonna answer it. Or you can just remember DLGM. DLGM. If you like this video, please give it a thumb up. We're gonna continue giving more mnemonics, which will help those who are taking MRCS OSCE exam, and it will be beneficial for any medical student or doctor want to learn about specific topics. Your like and your subscribe will take just 1 second, but it will help the channel grow. Thank you and have a nice day.